Hey guys, Dr. Hunt Physical Therapy. Today we're going to talk about some things you can do at home to treat shoulder pain, specifically impingement, either the rotator cuff or the bursa in the shoulder. A lot of people 40 plus experience these symptoms. Some of the most common ones are pain reaching behind your back, pain elevating your arm out to mid-range, pain washing hair, putting on a bra, I even hear reaching out the window to get the mail. These symptoms can become chronic and last a long time, but there's some things you can do easily at home to treat the shoulder. The rotator cuff muscles, which are simply the muscles on back and the front of the scapula, that really help stabilize the upper arm bone in the socket of the shoulder blade when we do any activity. A lot of times, even in our athletes, we find there's a strength asymmetry. So those rotator cuff muscles, the ones that rotate the arm in and out, are a lot weaker than, say, the chest muscle or the upper back muscle, and so they take a beating. And so I think everybody, 40 plus especially, should do rotator cuff exercises. I think it would go a long way on minimizing the amount of shoulder surgeries we see in this country. Also, that progression, sometimes you see it more in women, frozen shoulder. We call that adhesive capsulitis, but you wake up one morning after months of dealing with the shoulder pain and you can't elevate your arm, it's become locked up. And so I'm going to show you a couple stretches and then 4 or 5, maybe 6 of my favorite exercises you can easily do at home to prevent this and to even treat it initially. Of course, eventually we'll show you some things in the upcoming video stuff we do here at Hunt Physical Therapy to treat this. But today the goal is to show you some things you can do at home. Okay, thank you. Here we go. Okay, 2 of my favorite stretches you can do at home for shoulder pain, usually due to impingement of the rotator cuff or the bursa near that rotator cuff, are these. The first one is just kind of a posterior shoulder stretch. What I like to do is bring my arm across like that, palm up, and then reach up with my opposite hand and kind of lock it behind the elbow so you can really pull it across like that. Just take that until you feel a stretch, usually more in the back or top of the shoulder. Hold for 30 to 60 seconds. Here's a view on the other side. Again, just bring that arm across, reach up with the opposite hand so you lock behind the elbow, palm up, pull that across till you feel a good stretch in the back or top part of the shoulder, and just hold for 30 to 60 seconds. Okay, the next one that I want to show you that's really good for shoulder pain due to impingement is to do what's called a sleeper stretch. So hopefully you can see me pretty good. Just lie on your side, okay? I think it's real important, have that upper arm bone, the humerus, out about 90 degrees like that. Move the pillow so you can see me. So like that. Then you're gonna reach up with your opposite hand, so I'm stretching the right shoulder here, grab the back of the right wrist and just kind of rotate down. You see how my arm's at 90 degrees? That's important because if you start doing this, you're not gonna feel anything. So keep that arm bent at 90 degrees and just try to get that forearm as flat as you can. You're gonna feel this stretch and it's gonna come on probably in the same place as the other one, in the back or top of the shoulder, but hold this for 30 to 60 seconds. Studies show people with impingement, a lot of times, what we talked about before, a lot of people have really bad posture, which causes tightness in the back of the shoulder, which causes the head of the arm bone to translate forward, and just because of that, the shoulder's not mechanically sound. So just doing normal activity, your rotator cuff's taking a beating. So strong rotator cuff is not as easily injured. So now let's go out to the gym. I want to show you some things you can do at home. Some of my favorite exercises to strengthen the shoulder at home. So here we go. All right guys, now I'm going to show you a couple of my go-to exercises that I give my patients to work the rotator cuff muscle at home. You can get one of these bands at Walmart, really cheap, pack of 4 for about $7. I'm just going to use the easy resistance. I've got this towel roll because there was a study that showed if you put some kind of towel roll or some kind of roll between your elbow and your body when you do these exercises, there's an increase in blood flow to the rotator cuff. So it just makes it more effective. To do this, it's really important to keep your arm bent at 90 degrees. In the clinic, I see a lot of my patients cheat, they'll start doing this, which engages the tricep, which that's not a rotator cuff exercise. So keep that arm bent. I'll turn sideways so you can see a little bit better. And then you just rotate out, arm at 90 degrees like that. Just like postural muscles, these muscles respond to volume. So at home, think 3 sets, 15, 20 reps each day. If you miss a day, no big deal. Things happen, we know this. To work the internal rotator cuff muscles, I'm gonna turn around so you can see. Now you're going to go from out to in. You're usually stronger doing this, so don't be surprised if you need to get a heavier resistance rubber band. But everything is the same. You're just going, instead of in to out, you're going out to in to work the internal rotator cuff muscles. Okay? So we have external. This one's going to definitely be harder. And we have internal. All right. Now I'm going to show you another exercise you can do with this band. Years ago when I learned this, the person that showed me, the clinician, called it Huggy Bear, which I've always felt ridiculous saying that. But anyway, I guess you do kind of start like you're giving somebody a bear hug, but keep your palms flat like this and then just separate straight out like that. This works the posterior shoulder. I'll turn sideways so you can see me a little bit better. So if you guys can think of a good name for this exercise, you can include that in the comment section. And if you like these videos, please like and subscribe. We really appreciate your support. So there's 3 you can do with these smaller bands. Now let's show you a couple things you can do with larger bands and we'll be done. Okay, thanks. Okay guys, here's 3 more exercises you can do easily at home to treat shoulder pain, usually associated with impingement. Here are my bands again. These are longer. You can get these on Amazon. I know a pack of 4 for around 20 bucks, so not real expensive. This might be a review for people who've watched an earlier video, but I can't get enough of these rows. They're so good at promoting good posture as well as shoulder alignment mechanics. So when you pull back, just remember, squeeze those shoulder blades together, okay? I'm gonna come to the camera so you can see what I'm talking about. So a lot of people when they row, it's all arms. We need to see those shoulder blades come together. Like that, okay? So 3 sets, 15 to 20 reps. Chest out, shoulder blades together, okay? So that's a standing row. Straight arm push down, arm stay straight this time. Just works the back in a different position, different angle. But again, chest out, shoulder blades together. 3 sets of 15 to 20 reps, okay? If you want to invest a little money in some dumbbells, I'm going to show you how to do a proper shrug. Works a very important muscle called the upper trap, that muscle right there. One of the reasons that we do dry needling in the clinic is I read a study years ago that said people that have tightness or a spasm in that shoulder, that muscle's job is to create space for the rotator cuff muscle whenever you move your arm out to the side or really do anything functional. And if there's dysfunction in that muscle, that can negatively affect the mechanics of the shoulder. And so you can get rotator cuff impingement just because you have a trigger point or a painful knot or weakness in that trap muscle. So to effectively work the trap, a lot of people I see just kind of shrug like that. Here, I'll turn sideways so you can see. But allow your elbows to bend a little bit. You're not lifting the weight with your elbows, but if you bend your elbows slightly, that shoulder, that trapezius muscle, can shrug even higher as opposed to just keeping the arm straight. So allow a little bend in the elbow and just shrug up. I tell my patients, almost like your mom asks you if you ate the last cookie, you're like, I don't know. Bad joke, sorry. So again, at home, 3 sets, 15 to 20 reps. So that concludes some of my favorite things that we utilize to give patients options to treat their shoulder pain at home. There'll be more to come. Like I said, if you like, please subscribe, and we appreciate your support. More to come. Thank you.